We're going to go ahead and get started. Welcome today, everyone, to our stakeholder call to discuss the recently released final rule regarding Adult Protective Services, or APS. This is truly a historic moment, and we are really excited about this first ever federal regulation of APS. My name is Allison Barkoff, and it's my privilege to lead the Administration for Community Living here at the U.S. Department of Health and Human Services. And let me start by giving a brief visual description. I'm a middle-aged white woman with curly brown hair, wearing a blue suit jacket and a white shirt, and I have a blue ACL logo behind me. And again, for accessibility, we have sign language and CART here today. Please let us know if you have any issues. And I am joined today by two of my colleagues, Carrie Benson, who is ACL's Deputy Assistant Secretary for Aging, and Stephanie Whittier-Eliason, the Acting Director of our Office for Elder Justice and Adult Protective Services. Next slide. So let me begin by just giving a brief background and overview of the Adult Protective Services rule. I'll start with doing that. And then after that, Stephanie will walk you through the specific final provisions in the rule. And then Carrie will discuss the ways that ACL will help support states and the APS network in implementing this new rule. Next slide. Okay, background on the rule. So for those of you who are not familiar, let me start with just talking about who the Administration for Community Living, or ACL, is. As I mentioned, we're a federal agency that's part of the U.S. Department of Health and Human Services. And our mission is to maximize the independence, well-being, and health of older adults, people with disabilities, and to support their caregivers. We work to ensure that all people, regardless of age, disability, or level of support need, are able to fully participate in all aspects of community life, live with dignity, and make their own life choices. We fund a wide range of programs through a network of aging and disability organizations in every state and in communities across the country. We also play an important leadership role within the federal government, serving as an aging and disability policy advisor to the HHS Secretary, other HHS agencies, and other federal departments. We are unique in that we have an advocacy role to ensure that the needs of older adults and people with disabilities are included in federal policy. And one role relevant to today's call is that ACL is now the federal home for Adult Protective Services, something that has long been called for by policymakers and advocates, and that will be cemented by these new regulations. Next slide. So just to give a little bit of context, when I joined ACL at the beginning of the Biden-Harris administration, we worked to identify key priorities. The need to set minimum standards for APS by issuing the first ever federal regulations related to APS bubbled up to the top. Next slide. These regulations advance important priorities for the administration. One priority from day one has been a focus on equity and ensuring that all people have the benefit of federal programs. These regulations propose to improve consistency across APS systems so that all adults, regardless of where they live or who they are, will receive quality APS services. Also, in advancing equity, this final rule centers practices that are culturally competent, trauma-informed, and person-directed. The HHS Secretary and the President have recognized that health requires much more than just access to medical care. People's health is tied to social determinants of health, including access to critical human services, long-term services and supports, housing, nutrition, and more. APS systems play an important role in connecting people who are experiencing or at risk of maltreatment with the services that they need to address social determinants of health. These proposed regulations will also help ensure that older adults and adults with disabilities can live healthy and safe lives in the community, complementing other regulations that focus on the health and well-being of people, both in community and in institutional settings. And finally, I want to say that the Secretary and President have been steadfast supporters of expanding access to home and community-based services. And these proposed APS regulations are an important part of that effort, ensuring that people receiving home and community-based services, or HCBS, are healthy and safe and do not experience maltreatment, abuse, or neglect. Next slide. These regulations implement key provisions of both the Older Americans Act and the Elder Justice Act, and we've listed both of those out on the slide. Next slide. Just to give a little bit of background, and hopefully many of you have been tracking this, we've been involved in developing this rule for quite a while. Back in October, we published our notice of proposed rulemaking. For 60 days, the proposed rule was open for comment, and we received nearly 200 comments. Next slide. Stakeholder engagement is an important part of everything that we do at ACL, and stakeholders have played a key role in developing this final rule. Each comment we received was carefully considered by our Elder Justice team, and we made significant changes based on comments. I want to thank everyone who commented and helped inform our final rule. For example, we have lengthened the compliance period from 3 years to 4 years based on what we heard, and we removed the requirement to set staff to client ratios based on the reasoning that was presented to us. Stephanie will go into much more detail on these and other features in our final rule. The final rule went through a series of internal, ACL, HHS, and federal government clearance processes, and the final rule was published in the Federal Register on May 8th. Next slide. So excited that our final rule has been posted and that we are able to now start moving into implementation with you. Next slide. So now I'm going to talk about an overview of the APS final rule and really start with some high-level goals. Before I turn it over to Stephanie to walk you through details, I just want to share a little bit about what we are trying to achieve with this rule. First, state APS systems receive federal funding for the first time as part of supplemental funding during the COVID-19 pandemic. This funding was used to establish infrastructure and systems and address the huge increase in incidents of maltreatment, abuse, and neglect during the pandemic. In fiscal year 2023, funding for APS state formula grants was added for the first time to ACL's ongoing annual appropriations. And we were very pleased that the fiscal year 2024 appropriations that were recently passed this spring continue this critical funding. This annual funding at the federal level has made establishing ACL as the federal home and finalizing the APS regulations even more important. Our two most important goals for the final rule are to elevate the best practices from the field while minimizing burden for APS programs. Next slide. The final rule includes a focus on self-determination and respecting the right of adults to make decisions about their own lives. For example, the final rule establishes strong protections for people in or at risk of entering guardianship, with a focus on less restrictive alternatives to guardianship. It also provides guidance on the limited circumstances that should be considered situations of self-neglect that require APS involvement. The final rule recognizes that it's important for there to be minimum standards and expectations for state APS systems. It's really important to know that while this rule sets a minimum federal floor, it allows states a great deal of flexibility and options in implementing to go above them. The rule will bring more consistency to APS systems nationwide while respecting the unique needs of states and localities. ACL will provide robust technical assistance to states as they move towards implementing the rule. We're excited about working with APS systems and other stakeholders collaboratively in order to improve APS services for the people we serve. Next slide. So again, thank you so much for joining us today. Thank you for your partnership. And I'm now going to turn it over to Stephanie to walk you through the rule and timeline for implementation in more detail. Stephanie, the floor is yours.
I'm sorry, thank you. Okay. So to begin, we're going to give a broad overview of the APS rule. As Allison had mentioned, this is modeled on the National Voluntary Consensus Guidelines, and so establishes a set of national standards for the operation of APS that all state APS systems must meet at a minimum. We do encourage them, again, to go above as they identify other best practices. It establishes definitions for terms that are foundational to APS practice, and it does create a tiered assessment system to differentiate between cases that represent immediate risk and those that do not. I'll be going into each of these components a little bit more as we move through the slides. And finally, an important point on this slide is that the rule requires APS programs to provide at least 2 ways for people to report their suspicions of adult maltreatment and self-neglect that are available 24/7. And so therefore, one of those methods must be an online or an electronic method to report. Only one method must be, they must have at least 2. In addition, as Allison mentioned, the rule emphasizes person-directedness and least restrictive alternatives as core values in APS practices. And administratively, the rule requires robust conflict of interest policies that also support ethical APS practice. The rule promotes coordination and collaboration with other entities, and it does require states to create a state plan at least every 5 years and to submit annual program performance data to ACL. So we'd like to highlight here some significant changes from the Notice of Proposed Rulemaking that was published last fall. The first thing we're going to highlight is that the rule removes the requirement of a trust relationship. Instead, the rule encourages states to prioritize cases involving a trust relationship. This and other changes were made 100% in response to comments that we received about either unintended consequences that could result from the rule if we didn't implement some changes, or just another way of looking at the rule and the provisions that we had not anticipated. So along with that, we've narrowed requirements for a feedback loop, for example, with mandated reporters. So rather than all reporters who might be mandated in a state, we limit that to, at a minimum, providing information to the mandated reporter who reports in the course of their professional duties with consent of the alleged victim, and if the mandated reporter has requested some information back. We removed requirements for programs to establish for themselves staff to client ratios, and we also removed certain monitoring requirements. So if you've gone to the Federal Register, you will see that it's a long piece of web page for the entire rule. So what we're going to do is break it down for you so that you can understand what the different pieces are and where you can go to find the information that you're looking for if it's on a very specific topic. So first we have a background section in the rule, and that is on page 39488. So the Federal Register posts all the rules, notices, etc., in an electronic format online, but there is also still a print version. So we will include the pages for the print version, but that's identified as you scroll through the electronic version. So you could simply just go down and look for the notation for page 39488 to read the background. The provisions of the final rule and with responses to the public comments, that begins on page 39,490. And the APS system's public comment and agency response section by section begins on page 39,493. The difference between these two is that on 39,490, it is overarching comments that were received, whilst beginning on 39,493, it is section by section. And then finally, we have the required regulatory analysis that begins on page 39,520. After all of that, we have the rule that begins on page 39,528. It follows the preamble. Everything that I just covered is considered preamble. So here is the rule section by section. 1324.400, eligibility for funding, all the way through state plans. And we'll walk through each of these in brief. The rule begins with eligibility for funding. It states that the APS programs are required to adhere to all provisions in the final rule to be eligible for funding that they would receive under the Elder Justice Act. Key changes that were made is that we have clarified that the rule does apply to both APS entities and the few states that have what is called a bifurcated system. They have two APS programs. Both APS programs would be required to abide by the rule. Also, we've clarified that the rule does not apply to tribal APS entities as they do not receive a direct appropriation under the Elder Justice Act at this time. We do define a number of terms. I apologize, everybody, for that one. A number of terms that are foundational to APS. But we do allow flexibility, considerable flexibility in implementation. We have separated self-neglect from the definition of adult maltreatment. And we've added a few new definitions, such as what is a report and what is response. Again, eliminated trust relationship. And we have clarified in the preamble that there is no requirement to adopt the definitions verbatim. Each state's definitions must encompass what is included in the definitions that are outlined in the rule. For APS program administration, in this section, it establishes the requirements to have standardized policies and procedures for the state regarding settings, where do they investigate, the types of maltreatment that the APS program will investigate, to articulate who are the alleged perpetrators that they are able to investigate in a case, and all the populations that are covered by APS. Receiving reports, are there referral protocols? How are they going to implement a two-tiered system of response? It requires policies and procedures to, again, inform clients of their rights in an APS case under state law, and provisions for staff training and supervision. The key changes from the notice of proposed rulemaking is that in the preamble, we did add a discussion, a more robust discussion on person directedness to help explain more the inclusion of informing clients of their rights in APS cases, among other provisions. And we did clarify a number of components that we believe reduce the burden while still promoting safety of APS clients. In the section on APS response, this was originally in the NPRM under this title of investigation and post-investigation procedures. In response to comments about how that could complicate implementation for certain states, we modified the title of this section to be APS response. This is where we have the requirements for the state entity, again, to adopt standardized and systematic policies for essential functions, screening, triaging, what is the decision-making process, what is the process for evidence collection, and what are the protocols to make a determination or a finding and for handling the cases. We did clarify individual subsections in the rule so that it is much clearer what is expected, and again, removed certain monitoring requirements. Under the conflict of interest section, we require states to establish policies and procedures that prevent, recognize, and address when it is identified actual and perceived conflicts of interest. Key changes to this section from the NPRM is that we removed section 1324, 404A. For those of you who that mattered, you'll be glad to see that. And we did clarify that dual relationships are prohibited unless they are unavoidable. That is discussed in great detail in the preamble to explain what is meant by prohibited unless unavoidable. We clarified to whom the conflict of interest provisions apply, and we added new conflict of interest provisions related to the circumstances when APS is serving as the guardian for clients. And when conflicts of interest are not avoidable, we have added a requirement that the states must document what steps were undertaken to remove a conflict of interest, or at least to minimize any potential conflict of interest. In the section for accepting reports, we explain that the APS programs must establish methods for reports to be made 24 hours a day, 7 days a week, and establish minimum parameters for sharing information with mandated reporters. Again, the provision for making reports is that there needs to be a method for people to report. Reporting must be available 24 hours a day, 7 days a week. It is not that APS must field those reports 24 hours a day, 7 days a week. Again, we clarified that one method of reporting must be electronic or online, and again, clarified the conditions, minimum conditions for sharing information with mandated reporters. States are free to share more information with more people, but at a minimum, we've identified the circumstances under which information should be provided. In the section with coordination with other entities, it does require APS systems to ensure that they are coordinating with other entities in the state that are charged with detection, prevention, investigation, and remediation of adult maltreatment and self-neglect. Key changes is that first, we have added that the states need to coordinate with tribes in providing adult protective services. We have added critical incident management in coordination with state Medicaid agencies as a key partner, key coordination activity. We have strengthened coordination with financial institutions, and we have clarified the data sharing agreements. The rule was not intended to require that states establish data sharing official MOUs with every single entity. We have clarified that the data sharing agreements should be when it's appropriate and feasible. Related to program performance, the rule requires states to submit program performance data annually to ACL, and that they should retain individual case data from APS investigations for a minimum of 5 years. A key change you will see in the preamble that we have clarified the difference between the National Adult Maltreatment Reporting System data and APS performance data. The National Adult Maltreatment Reporting System, or NAMERS, collects incidence and prevalence data on individuals who have experienced abuse, neglect, or exploitation as it is reported to Adult Protective Services. That information is about the individual, the client, and alleged perpetrators. It is not APS performance data. So for this rule, we are adding the requirement that states submit that data. We will have a very engaged process with the state APS programs and public comment period on establishing what are those performance data elements and when they should be collected, when they will be reported, and in what format. There's a state plan requirement that each of the state APS entities develop and submit a single state plan to ACL at least every 5 years. So I'd like to repeat that. We have clarified that there's only one state APS plan. Even in those states where there are 2 APS programs, in those bifurcated states, they will submit a combined single state APS plan. At a minimum, that's the requirement. We changed the effective date of the rule from 3 years to 4 years. So the state plans would not be due until 4 years from the effective date. So the compliance date is 4 years out in 2028. We also have added that ACL will publish the state plans on its website to make that information publicly available. And we've updated the submission requirement to every 5 years or more frequently for state plans as a state entity determines. So for instance, in states that have the APS program co-located with the state unit on aging or in an aging office, and the state is engaging in a process to solicit public input for their state plan on aging, if the state wanted to follow that same schedule and include the APS state plan in the information gathering they're doing for their state plan on aging, they are certainly welcome to do that. But at a minimum, ACL must receive the state APS plan once every 5 years. So that was a very, very quick and high-level overview of all of the information that is included in the notice of proposed, I'm going backwards, in our APS final rule. I'm now going to turn it over to Carrie, who's going to walk us through the timeline, resources, and a few closing comments as well.
Thank you, Stephanie. Thank you, Stephanie. I think I'm unmuted now, so hopefully everybody can hear me. And thank you so much for going through a lot of information in a short amount of time. We have been trying to answer questions as they're coming in as well. And so we'll see if we have a little bit of time at the end of our presentation to walk through some of those Q&As at the end here as well. But as Stephanie said, I am pleased to be here with you today to be able to share with you how we're going to work with you to implement the final rule for adult protective services. We know, as Stephanie's brief overview even showed us, right, that there is a lot to implement. This is a big change for all of us nationally in adult protective services, and ACL stands ready to work with you. So I'll walk through a few of these dates here to get us started thinking about our next steps. The effective date for the final rule is 30 days after publication. So that will be June 7th, 2024. However, I want to emphasize to you all that the compliance date for the final rule will be May 8th, 2028. This was extended from 3 years to 4 years based on the feedback that we received and our interest in really providing you all with ample time to work through the changes in the final rule, what that means for your state and local entities, and for you to work through various changes in policy, program, and other components to come into compliance. So we will work with regulated APS entities through a supportive corrective action plan process if you do need more time to fully comply with the rule after the date of May 8th, 2028. So we will very much be providing robust technical assistance to each state as you work towards full compliance. And we'll go to the next slide, and I'll talk about some of our pieces that we are going to be providing to you in the near term as a part of that technical assistance process. We want to be sure that you are accessing the final rule itself. We encourage you to take time to read the register.
Carrie, I think you might
Allison?
need to turn your camera off.
Oh,
You're
okay.
breaking up a little bit.
Okay. Sorry about that,
Okay.
everybody. I just want to be sure that you are accessing the final rule in the Federal Register. So we have the link to the final rule there. And then we also have our APS rule webpage on the ACL.gov website. You will find fact sheets there, announcements, additional resources related to our technical assistance efforts, including information on upcoming webinars and other updates. So please do go to our APS rural webpage frequently for information and resources for you as you move forward with implementation of the final rule changes. We also plan to be at the usual conferences that you see the APS team and Elder Justice, Elder Rights team from ACL attending, and we will be sure to have a strong presence at those events going forward to provide in-person technical assistance and training as well. We want to stress that this is an effort that we plan to take with you and work with you very closely. We're excited to be able to have a team that includes project officers working with each of the states and our colleagues at the APS Technical Assistance Resource Center who will be able to offer a wealth of information, advice, and guidance to you. We want to make sure to encourage you to keep your questions coming. They are always welcome, and our team will provide responsive information to answer your questions as we are able to do so. So let's go to the next slide. And I want to share with you all, if we go to the final slide or the next slide after this. And this might be the final slide.
Actually,
I
this
do.
one is, but I do know where you want to go, so I will get us there.
Thank you, Stephanie. And
apologize.
again, I apologize
This one,
for
yeah.
for my audio going in and out, everybody, but I do want to share with you all that we've got, you will see our logo on a lot of different materials going forward for the APS final rule. We are here for you and committed to providing technical assistance and support to you all. We are so excited about this historic achievement that we could have only have achieved with all of your support, your input, your feedback, and we want to thank you for all of the amazing work that you all do every day to provide adult protective services to people with disabilities and older adults. We look forward to working with you all. At this point, I am wondering if we might want to go through some of the questions and answers, and Allison, looking for your guidance on that.
Yeah, I think we have time, and we won't be able to get to every single question. And ones that are kind of state specific, we will have some opportunities to potentially follow up. Let me first say, lots of people asked if there will be these slides will be available or the recording. And again, we have a website that's going to have all of this information at acl.gov/APS rule, and we will put those all online. And Stephanie, you can pull down your screen so people can see us easier.
I'm actually trying to do that and I can't get it to work.
Okay.
So.
Okay. Well, people will get to see your very nice screen. So
You.
that was one question. Great. You got it to work.
Thank you.
Another question that people had, a good one was someone asked about, in their state, is APS part of the Department of Human Services? And Carrie, do you want to maybe answer that? Because a lot of the answers to the questions people are asking is, it depends on how your state is organized. So do you want to answer that? And maybe actually at the same time, someone also asked which settings APS covers. And again, that's another thing that's defined by states. But if you and Stephanie could touch on that, that would be great.
Absolutely. Thank you, Allison. And I'm hoping I'm coming through a little bit better. And great. And yes, it really depends, on your state organizational structure, and where adult protective services is located within your state. And so that, because it depends, we are very much looking forward to continuing the close collaborative work that we started, with the first, installments, I guess I will say, of federal funding for APS, where we have been able to work with you all closely through your development and capacity building processes. So it depends on the functions of adult protective services. It depends on other functions at the state level, serving people with disabilities and older adults in terms of what your overall structure needs to look like, but even more importantly, what your policies and procedures related to APS need to look like. And I will turn it over to Stephanie to talk about the settings for APS.
Thank you. So the answer is it depends, again, based on state law. And you will see this throughout the rule, that the rule defers to state law in many, many cases. We are not trying to overturn state law or make anyone have to go back and change their laws necessarily. So what we've asked is that each of the states clearly identify where the APS program is authorized in state statute or by state regulation to investigate what types of maltreatment and who is involved. It does vary from state to state, and it is unknown by many people within their state who investigates what. And so this is an attempt to get more transparency and a clear understanding across jurisdictions who is responsible for what APS is responsible for.
Great. Couple other questions. So people were asking about kind of the rationale or the comments that came in for changes. What I can suggest to people is we have fact sheets that are pretty detailed, and we do describe the changes we made. If you want to look at the rationale, we have a well in advance of a longer than 100-page preamble, which is a discussion before the actual regulations. And we summarize every comment that came in and we respond to them. So if there's a particular issue you're interested in, or you're wanting to see what had we proposed and what had people said, I would encourage you to go, again, you can go to acl.gov/APS rule, click on the Federal Register and read the preamble. A second thing that a lot of people asked about is federal funding. And so let me just share a couple things, and then I'd invite Stephanie and Carrie to add to that. As I mentioned at the beginning of my presentation, there had never really been federal funding to state adult protective services programs until recently. It had been all state funding. ACL had been working with them. We had some voluntary guidelines. We provided guidance, but we didn't have a way to provide direct funding to state APS programs. In the COVID pandemic and the supplemental funding that came for fiscal year 21 and 22, that was the first time we ever had an opportunity to give federal funding to all state APS programs. And state APS programs really use that to put a lot of infrastructure into place. We did a lot of advocacy. You all did a lot of advocacy. And because of everyone's push in fiscal year 23, we for the first time got part of our ongoing annual appropriations funding for state APS programs. ACL has said through the president's budget, much more funding is needed, but we're really happy that there is a start of this ongoing funding. So when people ask how much money will be available, ask Congress that question. No, seriously, we put in a request, the president puts in a request. We just got funding for this fiscal year, which goes through the end of September. And then again, Congress will appropriate funding again, and ACL will continue to advocate for increased funding. But again, we don't decide the amount of federal funding. That's decided by Congress in its annual appropriations bill. Okay, let's keep looking through questions here. And oh, wow, we got a ton coming in. So Stephanie and Carrie, if you also want to, we got a number of questions actually, Stephanie, I'll throw this to you. People were asking about the bifurcated systems. And as you explained, that means ones that might have a separate system for older adults and adults with disabilities under 60 or 65. People were asking, what if my system only has one or the other? Can you just talk a little more about how that works? And I think all states actually have both, even though people might only know about one or the other. But can you talk about that? Because we got a couple questions about bifurcated systems or state systems that only serve, as people thought, older adults or younger people with disabilities.
Right. So to simplify the answer, if your state has a single APS, then that's who it applies to. Every state serves, actually, for their APS, it would be older adults, but it's not all older adults in every state. There are, eligibility requirements or what's called a threshold requirement for what are the parameters around an individual being eligible for services for APS. If you have a state, as Allison said, describe the bifurcated state that has two systems. One is going to be 18 to generally 59. I don't know if any of them are 18 to 64. I think they're 18 to 59 with a disability. And it's not just a disability. You'd have to go to your state and look at the law for eligibility for serving a younger adult population, what is called a younger adult population with disabilities. And then you'd have a elder protective services program where that serves older adults with within certain parameters who are 60 and older. that is where you're going to have two systems. And they are both called protective services. One is adult protective services. One would be elder or older adult protective services. Those states know who they are, and we'll work with them as we need to provide technical assistance and support. And then in the other states, it's just APS. Whether they would be just the few states that serve only older adults or the states that serve everybody 18 and up. Did I
Okay.
give what you were looking for? Or is
Yeah,
there-
yeah, I think that's good. And again, I want to be clear to everyone, we'll answer questions until 4, but we are going to be providing ongoing technical assistance, more webinars, more fact sheets. But let me jump into a couple other things that I'm seeing. So it sounds like a number of people had questions about the requirement that there has to be 2 ways to report, including 24/7. And so can you just give and I think some are in the fact sheets, but can you just explain that a little more and give some examples?
Right, absolutely. So the regulation requires that all states have at least 2 methods for anybody to make a report of a suspicion of someone experiencing abuse, neglect, or exploitation. So those can be, you have to have at least 2. And there's many different ways. People have phones with answering machines. People have faxes. What we're saying is that you can have whatever methods you want for people to be able to make a report. However, one of those methods must be electronic. The federal government has a provision where we are trying to encourage people to improve their technology, move into a more electronic format. It's easier for our consumers and the people that we serve to be able to interact with us and to get information. And so therefore, one method must be electronic. It can be an online reporting system where you go to a website and you answer questions. You might type in some information and you hit submit. Or it could be an email address where you just literally send an email from your phone or the computer to a reporting mailbox. There's a lot of different ways which a state could choose to meet that requirement that one method be electronic. And there's not one right answer. It just needs to be something other than a phone call, or in addition to. If you're going to have a phone reporting mechanism, you need to also then add an electronic means for people to report.
Great. Another thing that I saw a couple questions about, and Carrie, maybe you can touch on this along with Stephanie, is we talked about coordination with other types of entities, and people ask questions about financial institutions. So can you talk about what the rule says around coordination there?
So in the section on coordination, we identify a number of different entities that states should consider establishing, partnering, or coordination relationships with. And the rationale behind that provision is that, as anyone who works with APS and provides APS knows, that APS is one service that is provided to an individual, but there are a number of other people and organizations who could be or should be involved in the prevention, identification, and response to abuse, neglect, and exploitation. So in order to promote that well-rounded and robust prevention and response, and to help APS with what their responsibilities are, we are encouraging partnering. We've identified other investigative bodies, but in addition to that, as has been noted in the question, we are including financial institutions and financial organizations. It is beyond just an institution. We try to think through the different entities that are in that would have a financial relationship with an individual and what those might be, and include all of them sort of in the coordination. So we did originally have financial management, we had banking, and we have financial institutions as well. So the idea is that, to the extent possible, the state APS program is going to establish policies and procedures where they will be able to either interact with, engage with, partner with banking and financial institutions within that state, either for reporting or prevention, maybe training, whatever that state deems is most important. But with financial exploitation, you can't ignore the need to have those relationships with banking and financial institutions, in addition to the investigative bodies around, like financial regulators and securities, and those other enforcement agencies.
There was another question in there. We probably have time for maybe one or two more. Asking, since we're talking about coordination with other agencies, someone saying that they were trying to coordinate with their Medicaid agency. So as Stephanie mentioned, our rule talks about and encourages coordination with state Medicaid agencies, data sharing, MOUs. And I want to mention that we worked really closely with the federal agency that's over Medicaid programs called the Centers for Medicare and Medicaid Services, or CMS. And just in the last several weeks, they put out a rule, and their rule talks about the obligations of Medicaid home and community-based systems around investigations of critical incidents. And they very much, ours are mirror images of each other. They talk about how Medicaid agencies should be working with adult protective services as well as child protective services, other types of entities, including working on data sharing agreements and MOUs. So that is one place that, as we are developing technical assistance, as CMS is developing technical assistance, we hope to share examples of states that are doing this and sharing information well. So I know that's another thing that was in there. We are now kind of at time. So let me just end with a few thoughts. First of all, thank you everyone for joining. I was so amazed to see we had 1,000 people join this webinar. And I think that says so much about how important adult protective services is, how important this rule is. And again, I just want to say that the hundreds of comments that came in were incredibly thoughtful, and we really tried to be responsive to the fact that both these systems are so important in people's lives, and the amount of resources that these systems have is really little. So we really tried to focus on what are the most important things to put in place, and how do we work together to strengthen and improve APS and work together to get more resources. Second, this is just the start. As Stephanie said, we are going to be working over the next several years. It doesn't mean we're not paying attention. We are actually going to be working very hard. We hope many states will be able to comply with many parts of this rule well in advance of the time frame, but we also recognize that some states will have to make a lot of changes. They may need to even change state laws if there's a conflict between their state law and these regulations. So we are very much here as a partner to work with you. Finally, this is not the only information that's out there. We have an entire webpage devoted to this. Again, acl.gov/APS. Please keep checking back there. We'll be adding resources. Please look at our short fact sheet, our detailed fact sheet. We will be putting the slides from this and a recording from this webinar there. And we have a link to the entire preamble that you can read all of the rationale and reasoning and the regulation, all published in the Federal Register there. So please, please keep checking back. And more than anything, I really want to thank the ACL team led by Stephanie and by Carrie for this really hard work in putting this rule together, and the really hard work of rolling up your sleeves and working with APS systems and with disability and aging stakeholders as we work together to make sure our APS systems are strong and help keep people healthy and safe. So thank you, everybody, for joining us, and we'll look forward to sharing more information. Thank you.